Osteotomy for typical bowing deformity of long bone, and we call it atypical. I will explain you why. Corrective osteotomy is made to improve shape of bone, correction of axis, and correction of deformity. The place of osteotomy is usually metaphyseal, but sometimes in diaphyseal. It depends according focus of deformity. Oblique deformity of bone is usually treated by double metaphyseal or salami osteotomy, but we use it now, this atypical osteotomy on the top of deformity, because it's only one osteotomy which can resolve whole deformity. It's atypical, it's curve or oblique, and it's pivotal osteotomy. Atypical is because it's on the top of deformity. As I have said, usually is used to deformity here and here. The oblique or curve is because it's very long osteotomy, which could make complex correction of the deformity, and the level of deformity is very important. The preoperative planning is very important to do it. We can make this very long oblique osteotomy which can correct the deformity as is on this drawing. And pivotal is because we fixed this firstly with one screw which can fix the bone together, and the deformity is made around the pivot. When we fix this screw, we can make only osteotomy in the center of bone, and when we fix it, then we can finish the osteotomy, and then we can make fixation. If it is necessary, we used some neutralization plate or more screw for the fixation in our patient. Our cohort of patient is not very big. We have 18 pivot osteotomies because this bowing deformity is not very often here in Czech Republic. 6 are bilateral, 5 are unilateral in 8 patients. We make 5 tibia and 6 femur. All this osteotomy has been healed by primary healing. We can make very quick weight bearing, and it brings, although it looks on skeleton a little bit peculiar, it brings very good cosmetic results. You can see here is the patient with valgus deformity of the tibia. It's 13 years old girl. You can see that the osteotomy is made only with 3 screws, and on the next slides you can see very nice correction of both sides. This is another side of the deformity. This is boy which is 16 years old with valgus deformity of the tibia. Again, the same osteotomy on the top of deformity with fixation only with 3 screws. You can see the good healing in short time and good cosmetic results of this osteotomy. This is after removing of the screws. This is the typical bowing deformity on femoral side, which is on 16 years girl. You can see that we make osteotomy and fix it, of course, with neutralizing plate, because the stability only with screw should not be good. The position after the osteotomy is very, very good. And we must make, of course, another side, which is also the same procedure and the same results without any problems. You can see another patient with bowing deformity of the femur. Again, the osteotomy fixed with the plate. For the femur, we prefer fixation with the neutralization plate, and final results. This is after removing of the screws. Here you can see that the axis of the limb, although it looks a little bit peculiar on the skeleton, looks very fine cosmetically. To the conclusion, it is simple and very effective osteotomy. It makes correction without any shortening. It couldn't make shortening. It's cosmetically efficient. It is useful also in children in age with persisting persisting physis, because that's metaphysical fixation is not possible. It has some, of course, special indications, is bowing deformity, but it brings very good results. I can really recommend this type of osteotomy. Thank you very much for your kind attention.